Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and welcome to today's edition of Health Talk. Today we have the distinguished honor and guest of Dr. Andrew Zale, who's a pediatric dentist in Pottstown. Dr. Andrew Zale graduated from Penn State University in 2006 and then went on to earn his doctorate of dentistry in 2010 from the University of Pittsburgh. Then furthered his education and completed his residency from VCU in 2012. He was also inducted into the Dental Honor Society along his way in his course of his journey of education. Today our topic is going to be looking at a unique topic, which is going to be looking at oral hygiene and possibly cardiovascular disease. So, Dr. Andrew Zale, can you give us a little bit of explanation? Should there be normal bacteria that exist in your mouth?
Sure, there should be bacteria in your mouth. There's bacteria throughout your whole body, and especially in your mouth and your GI tract, because it's constantly open to the outside environment. And for the most part, these bacteria are good for you. They help many of your daily functions, and for the most part, they don't cause any issues. Now, if you create the environment for a bacteria to cause or to become bad bacteria, that can be a bit of an issue. And go ahead.
Okay, so so we have good bacteria, and then you're kind of alluding to that we have some even pathological or bad bacteria. What would create an atmosphere for bad bacteria to proliferate and grow and be abundant?
Well, it could be the environment could be something as simple as trauma, but it could also be if you were sick, if you had a systemic illness that left your immune system compromised, or if you introduced a new strain into that bacteria ecosystem's little niche, it can cause a shift and make bacteria that are typically good for you bad or able to produce a disease.
Does oral hygiene play into a concept of environment? You know, so if you have poor hygiene in the oral cavity and that type of stuff, does bacteria proliferate in an uncontrolled manner?
Oh, of course. There's two main areas of the mouth that bacteria tend to kind of proliferate if you allow them to.
Sure.
That said, anywhere in the mouth could be involved, but the two things, or the two areas that are most common, are the teeth and the gums. So for the teeth, it would be a dental cavity. So if you allow the bacteria to sit on the tooth in the plaque system, and over time, and you give them enough sugar, then eventually it will erode away some tooth structure and create a cavity. So that's...
Does it affect anything else besides the tooth? I mean, that's the most thing
that's
that most
the most
people
common, right. But then the second most common would be the gums. So, and it's the same concept. So if the bacteria are allowed to sit on the tooth, or by the gums, by not brushing, over time it can cause inflammation of the gums, and this inflammation is called gingivitis. That inflammation is reversible, usually within 2 weeks, with just improved hygiene measures, so improved brushing and flossing. Now, if you let that gingivitis linger, over time, that inflammation can work its way down into the bone and the supporting tooth structures of the tooth. With enough inflammation and enough time, it can eventually destroy some of that bone, and that would be called periodontal disease.
Is that reversible?
That is not reversible. So that's something that you can halt the process over time, but without grafting or any extensive procedures, once that bone's gone, it's gone for good.
So as a pediatric dentist right now, that's one of the things that you're always trying to prevent at this point, because you're trying to establish, you'll say, good, healthy oral hygiene into your younger patients at this point, so we don't ever progress to periodontitis, correct?
Right, because we don't see a whole lot of periodontitis or periodontal disease in children. But if we can kind of establish a lot of those habits and everything like that early on, then hopefully we prevent a lot of these things down the road.
Well, this is a very interesting thing. So as we were kind of preparing for this and looking at the correlation between bacteria and heart disease, and even endocarditis, and even spondylodiscitis, which I was kind of made aware of. It seems like it's the periodontal disease that seems to allow us to have access for the bacteria to move. Can you explain that a little bit, and how this all kind of transforms the bacteria to go from a mouth to a heart, or to
Sure. In order for the bacteria to cause any issues throughout the whole body, it has to get into the bloodstream somehow. Those with periodontitis or periodontal disease have more fragile blood vessels, inflamed gum tissues, so normal things like brushing, flossing, eating can all cause the gums to bleed, more so than someone with healthy gums. When that does happen, the bacteria that are causing that disease are able to enter the bloodstream, and once they enter the bloodstream, they can go wherever they would like throughout the whole body.
Sure.
And those with periodontal disease also have a higher count of bacteria. So something like that seems insignificant, like just brushing or flossing for someone with healthy gums, for them the amount of potential bleeding or the amount of bacteria that can enter the blood is higher.
Okay.
So once it can get into the blood, like I said, it can go wherever. And we're talking about heart disease here today. So I think the classic example would be they've cultured some of the atherosclerotic plaques they've taken off someone with heart disease, and they found the oral bacteria on those plaques.
Sure.
So we know it can get in there. All right.
Gotcha.
The research has showed us with several theories that they believe that the bacteria can not only invade the endothelial cells or the cells that line your blood vessels and cause dysfunction or abnormalities within them, but they can also affect platelet function.
Sure.
And both of those things can also place someone at a higher risk of developing heart disease. That said, also, those with a severe chronic periodontal disease have a chronic low-grade inflammation throughout their whole body.
Sure.
And as you know, chronic low-grade inflammation isn't good for any body system. So that can really put someone at a higher risk for cardiovascular disease, and it can also kind of affect or decrease the effectiveness of their current control.
Yeah. And again, just as I was preparing for this and looking at this topic, you and I came to the conclusion and saw some of the research that was just posted in February of 2012 identifying new strains of Streptococcus that they're actually saying that is found in the mouth and absolutely 100% correlated to the highest concentration in the atherosclerotic plaquing. I think that came out of Zurich, if I'm not mistaken.
Okay.
So, you know, it is just amazing on the connection from the mouth to every other system at this point that we're looking at. We were discussing before that we were also looking at periodontal disease and tooth loss. Can you explain, if you have tooth loss before the age of 35, how that affects mechanics of, you know, chewing, and then how that also might have a relationship to cardiovascular disease?
Sure. What you have to realize is your teeth play a very important function. You know, not only, you know, for looks, for smiling and talking, but eating is a very big role. Probably, suffice to say, probably one of its most important roles. And without those, a lot of individuals don't realize the struggles one would have with trying to eat without teeth. And without teeth, it's hard to eat some of those healthier foods. You know, chewing into fruits and vegetables is hard. So lots of times, these individuals without teeth are kind of forced to eat a soft diet, a diet that's high in sugar, a diet that's high in fat, and things that typically you wouldn't consider part of a healthy overall diet. And that, again, can put someone at a higher risk for cardiovascular disease. Okay.
So here's where we kind of start looking at, is optimal oral health, can that be preventable for heart disease? Is that where the literature and the evidence is taking us right now? I mean, is it just a contributing factor, or is this something that can be preventable? Because cardiovascular disease is the #1 killer of Americans as we sit here today.
Right. And you would look at it and you would say, man, I wish there was that was the answer. You know? I wish that you do this and simple fix and you don't get cardiovascular disease. But you have to realize that cardiovascular disease is extremely, extremely complex. The risk factors, the mile long. You know, and no, periodontal disease will not prevent cardiovascular disease, or controlling periodontal disease will not prevent cardiovascular disease. And there's been quite a bit of hype about this. There's been a lot in the magazines and in the media about it, to the fact that even shows like Dr. Oz, they run specials on it. And he even came to a point where last April the American Heart Association put out a statement saying that there is no cause and effect relationship established between periodontal disease and cardiovascular disease. But there is an association, right? And that association is what we need to kind of focus on here. So no, it won't prevent it, but considering your oral health as part of your overall health can help you be a healthier individual and hopefully check off one of those risk factors for cardiovascular disease.
I think according to the Mayo Clinic and even probably the American Dental Association at this time, I mean, how do you obtain optimal oral hygiene and health at this point? I mean, what's your recommendations? The patient comes into your office and you're saying these different things. I mean, so what's your recommendations off of these things?
So, I mean, to optimize oral health, there's two things you look at. You have to look at your oral hygiene and diet. I mean, those are our bread and butter, our main things. In terms of oral health, brushing twice a day, flossing daily, are the two most important things.
Cornerstones, basically.
Cornerstones, exactly.
Yeah.
And the ADA recently put out an ad campaign, the 2-minute campaign. So they're trying to get everybody to brush for 2 minutes every time. Yep, 2 minutes. There's some pretty funny ads out there.
I'm sure.
Other than that, regular visits to your dentist every 6 months is what we recommend, and just listening to their preventative therapies, whatever the dentist would recommend. So we always recommend fluoride treatments. Other preventative methods would be something like sealants. Another one would be if we have an individual who we believe is at a high risk for developing oral disease. Instead of coming every 6 months, we might say come in every 3 months. And someone that's at a very low risk, we might say come every 9 months.
Sure.
So that's for oral health. That's what we're worried about. Now for diet, obviously we're worried about the sugars when it comes to teeth. So, and I always say it's not how much, it's how often. So what we try to do is limit our number of sugar insults. So we consider every time you take a sip of a soda or juice or a sugary snack, that's considered a sugar insult. When you have something like that, it keeps the pH of your saliva acidic for up to 20 minutes. So if you can limit those insults to around meal times, you don't have to worry about your teeth constantly being bathed in sugar. So you will have some children that, you know, sip a Mountain Dew or a Diet Coke all day long, and what they don't realize is that, well, their pH is low in their mouth or in their saliva for basically the entire day. So they're bathing their teeth in acid, they're bathing their teeth in sugar, and that's when we run into a lot of problems with the teeth.
So let's look at a couple different things. So we were talking about this earlier. So we look at soda, eliminating that. We look at eliminating or cutting down on like the gummy snacks and that type of stuff. But like our sports drinks, I mean, can you give a little bit of clarification on sports drinks? When should we be consuming them as kids? And because they seem like they're replacing soda, so is that a better alternative, or is that something that we need to be thinking about?
I wouldn't consider it an alternative for soda or for juice or anything like that. I mean, it still has a lot of sugar in it. I would recommend that you use sports drinks just as they're marketed as sports drinks. So if you can,
good advice.
So if you can use them just at that time, I don't see that being an issue, because again, you consider that your sugar insult the hour you were playing soccer, the hour you were playing basketball or on the football field. I don't think that is an issue. We do run into a little bit of a kind of, I don't want to say a battle with the physicians or the medical community, but we do have children that have some feeding issues, and lots of times they'll be on sports drinks like Gatorade or Pedialyte or Pediasure throughout the day, and that's a battle that, you know, sometimes it's tough because we can't recommend that they not consume that, because that's what's keeping them healthy, just for their, you know, the sake of their teeth. But if that is happening, then that's something that, you know, dental visits become even more important. So if you're having feeding issues and you're on a constant stream of Pedialyte or Pediasure, we're probably going to want to see you more often and catch anything a lot earlier, and that way we can kind of work together.
So you'd want a much more co-management in those cases. That's very important for, I think, for our community to know. You know, if we're in a situation where you have a feeding disorder at this point and Pedialyte is your main source, then I think the dentist becomes a major player in that approach to team health as well. Yeah, that's what we're trying to do. We don't want it to be medicine and dentistry. We want us to be, you know, to be working together. So here's another question, and I kind of want to throw these out to you. Is an electric toothbrush better than a manual toothbrush? Well, I say that the best toothbrush you have is the one you use. All right? I like that too. Basic research tells us that if you do use an electric toothbrush, you have improved oral hygiene for about 2 weeks. So it's kind of the fad thing. So you get it, something new, you use it. But over time, if you follow that study along, eventually it all levels out, and the hygiene's about the same. That said, I would always recommend electric toothbrush, one, if it makes you use it, but two, if you have some sort of manual dexterity difficulties, arthritis, things like that. So those are some circumstances where I would recommend an electric over a manual, but for the most part, just use it. As long as you're using it and you're using it correctly. Dental floss versus water pick? Two different things. So we use the dental floss to clean in between the teeth. All right. So where most cavities start in between the teeth is right below where the teeth touch. So if you picture two teeth touching right below that area, and dental floss can really get in there. All right. A water pick has some ability to get in there, but I would reserve a water pick for someone who may be managing periodontal disease or has some pockets along their gum tissue, some hard to reach areas.
those areas would be best served by a water pick.
Okay.
Again, I would go to your dentist before I would purchase
Sure.
one and use one, because water picks can be very destructive. Yeah.
Okay. Last one of the products too is again mouthwash. I mean, there's so many different mouthwashes out there. I mean, what are you recommending?
Well, if I may first,
Sure.
Mouthwash does not replace floss, because that's another common misconception. A lot of people say,
Sure.
well, I don't floss, but I use mouthwash.
Yes.
It's not the same thing.
Okay.
For children, so if you're looking at a mouthwash for children, you want to pick one with fluoride,
Okay.
and one without alcohol.
Okay.
Right? So Listerine makes something called Smart Rinse. It's basically Listerine without alcohol.
Okay.
So just because you don't want your kids swallowing or
Sure.
using mouthwash with alcohol.
Right.
Other than that, I would really focus your mouthwash choice or any of your oral health product choices on what your needs are. So there's mouth rinses and there's toothpaste out there for people with sensitive teeth. So if you have sensitive teeth, that kind of tailor your products to that. Pretty much everything now has a whitening component, but you can kind of look at a whitening, a whitening rinse or whitening toothpaste. For the most part, you just want to have something with fluoride in it, because that definitely helps, especially since Pottstown's water is no longer fluoridated. So fluoride becomes a bigger role in what you get, while you're brushing, while you're flossing.
Sure.
But most importantly is you want to look for the ADA seal on it. So anything that's has the ADA seal on it, I mean, it's been approved, it's been approved by the ADA, and that's probably your best and safest way to pick a product if you're unsure.
And last but not least, when you're looking at the equipment and the tools that we use for cleaning our teeth, I mean, how often should we be replacing the toothbrush?
I would say about every 6 months, 3 to 6 months. It depends what kind of brusher you are. Some people, really go to town on their toothbrush. Other people are a lot gentler. What you want to look at your toothbrush is if it's starting to fray. So if you look at the bristles and they're all starting to just splay out, it's time to get a new toothbrush.
Okay.
Another time I'd recommend replacing your toothbrush is if you've been sick. So if you've been sick, I'd definitely advise on getting a new toothbrush. But usually anywhere between 3 and 6 months. It really depends on
the usage of it.
How you use it. A lot of them now too also have little indicators. So there'll be a little like yellow line that you'll wear through or something like that, and that'll tell you.
Okay. So here's one of the favorite parts of the show is your take-home message. I know you don't see a lot of periodontal disease. I know you're trying to move a population in the concept of prevention of periodontal disease. I mean, what's your take-home message right now to the community, and what do you want people to take away from what we just said here today? Sure.
I guess my biggest take-home message would just be prevention. Fortunately, all these oral problems we talk about are preventable, and they're preventable in the ways we discussed with twice daily brushing and flossing and visiting your dentist and listening to their recommendations. And that would be, I mean, really, as a pediatric dentist, like you said, we don't see a whole lot of the advanced stages of disease, but our goal is really to prevent a lot of them from ever occurring. So definitely we want to get the children into the dentist, and we want to get them comfortable there. We want to set them up so that there's no dental fear, and that they can just have a lifetime of just stress-free dental appointments where we don't hopefully have to be talking about a lot of these correlations later on in life.
Absolutely. Dr. Zale, thank you very much for being on our show. It was a pleasure and honor, and I hope you can come back in the future to give us an update on the progress.
Sure, definitely.
So the mission of Health Talk is basically to provide the latest information and evidence of the day to our community so that they can make the best informed decision regarding their health. Good day and good health.